nurses are trained in advanced physical assessment, so they can act as the provider's hands in the room with the patient. As the provider, I'm able to direct the exam in real time from wherever I'm located by dictating to the nurse any maneuvers that I need her to perform in order to get findings on a patient. Of course, if I need to see any finer detail in a patient, we have a variety of cameras that we can use to make sure that I'm getting the information I need to make a high-level clinical diagnosis. Today, Patty's going to demonstrate on herself how to look inside a patient's ear with our otoscope. So Patty will put the screen in presentation mode, which pulls up the camera feed in large view for me and moves the patient's view to the side of my screen. So here Patty's looking inside her own ear, and I can see her beautiful, healthy eardrum. For me, this is nothing very exciting. This is just a normal image that I see all the time, although it is very clear and allows me to make a good diagnosis. For the patient, this is something unique. Most of us have never seen the inside of our own ears or the backs of our own throats. And so this really empowers patients to be members of the healthcare team here and to help them understand why we're making the decisions we're making about their health. None of these images are saved unless we snap and save the image directly to the patient's chart, so it is all HIPAA compliant. We have the otoscope here as well as a general use camera, which allows us to zoom in on any part of the body that we might need in order to get a better view of the patient. For example, here we're looking at a close-up view of a patient's eye. We also have a Darn camera, which allows us to zoom in very closely on skin. This has markings in millimeters, which allows us to measure and keep track of different lesions and save these to the patient's chart. We also have a fundoscope attachment, which allows us to get a very good image of the back of the patient's eye. Traditionally, when using a fundoscope, the room needs to be completely darkened and the patient's eyes need to be dilated. But with our camera, we can actually just use a regular dark room. We don't need any dilation of the eye, and we're able to get a very clear image to save to the patient's chart.